So I think this is another area of great interest to us and me to develop vaccine for myeloma. So any myeloma specific or myeloma selective antigen can be theoretically utilized to target by immune cells. And the one presentation that you mentioned, it was not just for myeloma, it was a neoantigen vaccine or peptide-based vaccine being developed to target any and a lot of cancers. And so basically what this study did was to do sequencing, found the genes which are mutated, so they are new in the body for the cancer cells and not other cells, and using those targets, develop peptides and specific for the patient, and those peptides could be utilized to induce an immune response. And it's a interesting new area of work where this new antigen can be targeted. We have also utilized similar approaches targeting some of the common well-known myeloma-related and overexpressed antigen. We have peptides that have been developed against XBP1, we have peptide against CD138, we have peptide against CS1, we have peptide against BCMA, and this peptide can induce immune responses and provide a benefit. BCMA is a good example because it is still very myeloma plasma cell specific target. So if you induce immune response against BCMA, that would have a very narrow activity. And we know BCMA is a great target. So I think there is a great interest in developing similar vaccination type of approaches for this patient. And we do believe that that kind of immune response could have a great potential as a longer term maintenance strategy. So if you vaccinate patient with new antigen or any of these other known myeloma related antigen, say post-transplant or post-CAR-T, then that immune response can be sustained to control the disease for long term without needing to do something. So I think developing vaccine has a great potential. Currently, we know with the real great research being done for COVID vaccine, there is so much more information that we can now repurpose from COVID to cancer, myeloma for our example, and use RNA-based and many other approaches to utilize these targets to develop cancer-specific vaccine or myeloma-specific vaccine. So there's great enthusiasm that we can use something good out of this terrible time we are in with COVID to benefit other patients.